way the Compass Academy came about, we had a program called Clinical Day that started in the year 2001. The Compass Academy, because we felt like we were catching students too late. By the time you have a student that's 17 years old or 16 years old, which is kind of when we were catching some of our students, you hate to say a student's too far gone, but if you've got mental health issues, if you have a student that's dealt with mental health issues for that long, where are you when you're working with children for that long, where are you getting them that long? Sometimes they haven't gotten the help they needed, and by the time you get them then you're not able to help them, and then they're already out of school, they've already graduated, things have already gone on too long. So we decided we need an elementary component, and that which evolved into Compass Academy. So anyway, as that happened, so we decided we needed to form Compass Academy, and that evolved from needing an elementary component. We have students daily that need help, that have mental health needs. So that's how that evolved. When you are working in the school district like we are, we have students, and you may have heard today a lot about suicide awareness and all that. We have students that are daily, what we deal with daily are threatening suicide. Whether that's in elementary school, whether it's in middle school, whether it's in high school. I want to mean elementary school, we see it in kindergarten. And you think, how does that happen? And I don't know how to explain it, but it does. We see it in our community. If you see our students that when their IDs, we were in a restaurant, and people that, when you've worked in the district as long as we have, again, I've been in the district 25 years, and people just feel like they come up to you and just say whatever, and they say, why do y'all have suicide hotlines on the back of students' IDs? That's ridiculous. And I said, well, let me tell you. There's not a day, not a single day that goes by where we don't have a student that threatens suicide. And not just one. There's not a single day that goes by. So our job, and whether it's at home, whether it's at school, it happens every day. And I said, we have an obligation to those students to have to provide them a way to communicate what they're feeling, whether that's at home. They could be sitting at home and saying, gosh, I have these feelings, and not have anybody to talk to. Well, they have that suicide hotline. And it might be extreme, but that's the world we live in. And so that was born. That's kind of where Compass Academy came from. Dr. O'Malley came to us, and as we were talking through all these things, and we actually met with some other school districts, and we all kind of met and talked about how can we accomplish what we need, how can we come up with a program to work with students that have these extreme mental health issues. And I think there were some, you correct me if I'm wrong, and she usually does, but how do we come up with a program that can help these students? Can we wait on the state? There are some grants that we can write, and I won't say there's other school districts, but they said, well, why don't we talk to the state? Why don't we write these grants? Why don't we do these other things? And if y'all have ever met Dr. O'Malley, we kind of waited, and then he came to us and said, we can't wait. And we all agree we can't wait. And we'll get more into that.
So where were our elementary school students previously? When we took a look at Compass, and Brian kind of talked about it, our elementary school, our secondary services were already in place to a certain degree, but our elementary students kind of fell through the crack. They kind of fell in the same category as students who just had misbehaving. So if they had a mental health crisis and they were acting out in classes, what would happen is that they would be suspended or expelled, just like a child that had behavioral issues. We knew that was not the answer. They would be home sometimes 30 days, 60 days, an entire semester, and some were even suspended for an entire year. We could not continue to go on and allow the kids to be at home. That's kind of what kind of birthed this new concept of Compass Academy. And if you take a look here, here's some pictures from the program. We have one of the, we have one of the classrooms, and this is the secondary R&R room. That's the classroom where the students will go, well, that's a room that the students that are having escalated behavior issues in Compass Academy, they may go to that calm down space to get back to baseline so that they can return to their classrooms. It removes the shame, it removes the embarrassment, and they can de-escalate and go back in as if nothing ever happened. Typically, what do you think happens to our kids when they have acting out behaviors in the classroom? What typically happens? Anyone? What typically happens when they get act up in the classroom, throw chairs and knock their books off the, go ahead. Sent home. They get suspended. In Compass Academy, that is not the first action. When they have those behaviors, what will happen is that a behavior interventionist or a school-based therapist will go in and gently remove them from the classroom and allow them to go to the R&R room, or they'll remove them from the setting, but it's not called the parent to tell them to come and get them. Here's some additional pictures.
I'll say, if you'll see, gentlemen at the bottom, we have a partnership, Liz and Arthur Moore. Arthur Moore is back there in the back. We take our students to equine therapy or horse therapy several times a month, and that's been a great partnership for our students, and it's very, very a unique opportunity for them where they go and get therapy with horses. And if you don't know anything about that, you need to read up on it. It's very unique and it's very therapeutic for the students, and actually therapeutic for the horses. But it's a very unique opportunity for them, for those students, and it's a very unique opportunity here in Florence. One that is a great benefit for them, and it's something the students look very, very much forward to, and it's awesome. It's awesome.
They get a chance to build like a therapeutic relationship with bonding with the horses. And I've heard some of the staff members talk about how calming it is. You take a child who may be extremely aggressive in other areas, and you couple them with a horse or with a donkey, and they have an opportunity to just walk with that animal and just bond. And I look forward to this year being able to go out, and I wanted to take the school-based therapist team too, so I'll be contacting you very soon. You had a question?
I was just going to say, that would be a wonderful thing for just, I know you're a school-based therapist, but a wonderful thing for teachers, because teachers need, mental health breaks. I'm just saying, if principals want to do that for teachers,
I caught it. I caught it. I'm putting it in my pocket. Yes, I am. Listen, I'm never, people who know me know I'm not afraid to ask for something. You're gonna get a yes or you're gonna get a no, and I will ask. And I saw your hand go up too.
I'm asking because I'm curious. I want to know, how do you decide what's mental health and what is not mental health? If I throw this chair, is that mental health?
So there are some underlying factors that might contribute to that behavior. And we're going to get into that because that is an interesting point, because it is really hard to sometimes differentiate what is mental health issues and what is not. And so we have a unique opportunity within Florence One Schools, because there's a school-based therapist in every school. We sometimes have historical data on the child. We might have family information that will let us know what is going on with them. And so although the teachers might not know all of the intricate details of what's going on with that child, the teachers will know if they're our kids. And all the therapists are really creative in how they let the teachers know which kids are theirs. We're not violating confidentiality, because in the school system we operate under a system, instead of HIPAA, we operate under FERPA. So when I was in the school-based therapist role, behind my kid's ID, like Brian said, will be the crisis line. And then also I had a red tag that was behind their ID, and you could not see it. But if they, I already informed the teachers at the beginning of the school year, my kids, they're not to tell you what's going on with them. But if they walk up to you before they're escalated and they flip their tag and they show you that tag, that tells you that they are mine. And so they can exit the classroom and come to my office without letting the whole classroom know that they're struggling with their mental health. And so each therapist is different and creative in their ways of actually doing that.
Because sometimes they might act out and throw chairs at home. So that's not necessarily mental health. These days, right?
Well, We'll talk about it. We'll talk about it. We'll come back to it. All right, and this is the Compass Academy building. They're located on the backside of South Florence High School. All right, let me start with this.
So this is just our elementary schedule. I won't go through it with a fine-tooth comb, but you can see we actually have our elementary and secondary students in the same building, but the way our schedule is built, they have very little interaction with one another. They're like ships passing through the night during the day, and we've never had any issues with the secondary elementary students being on the same campus together. I want to show the secondary schedule and their secondary schedule. The way our secondary schedule works, Miss Patty Nunley is back there. She is one of our secondary teachers, and she works with the homeschool and gets some of the work from the homeschool. Some of our students work through Edgenuity, which is an online program. It helps the students work towards getting high school credential hours and working towards a high school diploma. So students are not falling behind. That's the other thing. When our elementary students and our secondary students, if they're at home, if they're placed on home-based or homebound, it's oftentimes hard for them to catch up and stay caught up. And the last thing we want to do is for students not to get a high school diploma if they're capable. And so with the Compass program, if they can come to school and stay caught up, that's what we want them to do.
I have a question. Do they transition back to school?
Let's get to that.
Okay.
So the enrollment for Compass is also unique. Compass is not appropriate for every child. The Compass program is our most restrictive program. It's a separate setting for the students. And so enrollment is based upon some key factors. The students at Compass Academy would have had at least 2 incidences of suicidal or homicidal ideation that led to inpatient treatment. They would have had to have multiple incidences within the schools, like suspensions, expulsions, things of that nature, and they would have needed to be on the therapist caseload, whether that is with PD mental health or with our district hired school-based therapist for a minimum of 90 days prior to the school-based therapist doing an application for that child to go to Compass. So it's not a teacher referral, it's not a parent referral. The referrals come from the school-based therapist at all of the schools. They will fill out the application to make a referral for a child to Compass. And then they also have to demonstrate that this child has had significant mental health disruptions in order to be sent to Compass. And the approval comes by way of a team, with Patty Nunley leading that team from the academic side, and then Lisa Barber, they're both in the back of the room. She leads a team from the treatment standpoint of things to determine if the kids are appropriate for Compass Academy.
I'll say that people think that, Compass Academy, it's an alternative to school, but it's not an alternative school. We think about our Rush Academy as an alternative school. Compass Academy is not an alternative school. We're talking about kids that have mental health issues, not that are, I guess we hate to say that term, BAD. It's not kids that are having that. These are kids that have underlying issues why they have the behaviors that they have. A lot of our children have trauma, and a lot of the reasons why they have the behaviors are because of trauma. And we'll talk about the different kinds of trauma. Crystal has a whole chart that looks at different types of trauma, and we know that lots of our students' behaviors, throwing of chairs, is because of trauma. Yeah, and unfortunately, we as adults are responsible for the majority of that trauma. So we'll get into that. Do you have your hand raised?
So what do you mean when you say alternative to school?
So it's an alternative to school. In other words, like she said, a lot of these children, when they have those behaviors, even if it's related to a mental health issue, they end up at home. So this gives them an alternative to stay in school instead of being placed at home for the remainder of the year. A lot of these students will end up staying at home, getting instruction through someone at home, and it's minimal instruction. Even though they continue their education, being at home and receiving instruction at home is not the best. And this is certainly the best alternative to that.
In the traditional classroom setting, what comes first? In a traditional classroom setting, what is the focus of the teacher? To do what? To teach. When you take a look at Compass, equally, the focus is both on mental health and education. Both are at the forefront when we take a look at servicing the kids in this school. Compliance with prescription medication management. Now, we do know that there are some parents who are like anti-medication, and we understand that. We respect that. However, if your child is a candidate for Compass Academy, the parent has to agree to do the entire program. And part of the entire program is that they also have to be compliant with medication management. And then also with a willingness to enroll in the psychiatric services that are provided through our community-based providers, or we also have a partnership with a psychiatric nurse practitioner who prescribes medications for our students as well. All right, so there's a little bit of differences between the elementary and the secondary level Compass program. At the elementary level, that's grades 1 through 5 in a general education setting. And they have to meet all the other criteria in order to be there. But grades 1 through 12 at Compass also serve students students are being served under an IEP category for emotionally disabled students that also may require more intensive mental health services. We added an additional portion that we sometimes consider students who have come home from inpatient care. The plan is for them to return to their home school, but they may need some stabilization, like a step down, before going back to their home school, and that kind of runs about 30 days, give or take.
We have a lot of students that are, for whatever reason, may be placed in a residential facility, and you think about they may be in a residential facility for 30, 60, or 90 days, and then when they're done, that facility expects them to go back to a school. And so they go from a facility where their classrooms might be 15 students to a school like South Florence with 1,600 students. So you're talking about going to a very, very small, focused, calm setting to go into a high school between 1,600 and 1,700 students. And so there's really no step down for them, and there needs to be a step down. And so we have used Compass as a step down for those students to be sure they're ready to return. And as long as we can get information from the residential setting. And so we really and that has been successful for the most part of letting those students come, and then we can kind of assess whether they're ready to be in a regular high school setting. So,
and as Dr. Khan mentioned earlier, you don't want to take them and just drop them in such a large setting like that. We want to make sure that they transition back in a safe means. So Compass Academy staffing, we have 2 leads, one educator lead and 1 clinical counselor lead. 3 school-based therapists to provide individual and group counseling, 2 behavior interventionists, and as you can see, you kind of can work through the list. And we also have a nurse that is actually dedicated to providing nursing services to the students at Compass. All right, and this is just a few slides on meeting our leadership. And as we go through their names, if they're here, we ask them to please stand. Ms. Patricia Nunnally. She's our lead educator for Compass Academy. Ms. Lisa Barber. She's the lead therapist for Compass Academy. Dr. Pat Morrissey, she's not here. She's going to probably come in a little later, but we also have Ms. Dana White. She's also a therapist with Compass Academy. So our behavior interventionist team, we have Mr. Alonzo Scipio. He's a behavior interventionist, and then we also have Kathy Morris, who's a behavior interventionist. And this is our academic team. We have Dr. Wiggins, who's a teacher, and Ms. Gibbs, who is also a teacher. Ms. Townsend, who's a secondary teacher, and then Ms. Gabo is a classroom assistant, and our administrative assistant as well. And I know I kind of breezed through those, but everybody within that building, not only do they have the specialization to teach, but even the teaching staff have had extensive experience with working with this population as well. Even right down to our administrative assistant, she's had experience working at the school level and in education as well.
We also have Shauna Richardson, our nurse. is
Yes,
back
I'm
there,
sorry.
too.
Yes, please stand up, Ms. Richardson. And she's not just a nurse. It is all hands on deck when we have a student in crisis over there. So whatever role you play over there, you put on all of your caps together when we have our babies are in crisis. All right. So here's a question for you. Where do you think the need comes from? Why do you think there was an increased need for attention to student mental health? Societal, parental, educational. Why do you think that has been an uptick in the last few years that led us to Compass Academy? Anybody? Go ahead.
One thing that could have led to it is some less socialization and more focus on screens. I know people like to talk about that a lot, but maybe more focus on screens, and that's less possible even talking in the home, one-on-one. And so, they just possibly, here, look at this tablet, or something. And so that might lead to not knowing how to deal with emotions and things of that nature.
Right, right. More
Yes.
like seclusion, being
Yes.
more isolated and not
Yes.
being around others. Anybody else have any thoughts out there?
With the rise in COVID, it didn't just it didn't start there, but when you were isolated and you were at home, you had to deal with a lot more issues. A lot of people, when they deal with stress and mental health issues, they stay busy, they stay connected to people, and then you had that sense of isolation, and parents having to deal with different things. And our whole society had to think about their own viability. Will they be here today or tomorrow? So, and then you put them back into the schools, and those kind of things are still going on, and our society is constantly changing. So you start to see a lot more of discussions about mental health. And kids, although we say we should have all of this access to social media, it's more openly discussed now. So kids have a voice versus just being seen and not being able to speak how they really feel. They're not adults, they're children, and they're encompassed with adult-like situations. So again, I think a lot of this is our parental stressors that they were going through, as well as societal stressors. And now even the society is more open to openly discussing mental health. So it hasn't just started there, it's just being more visible when we're talking about it now.
Absolutely. And one of the key things that you talked about is the use of social media, and you did as well, the use of social media being more of an empowerment tool. So they're going to use it. So just helping them to find the apps and different things to explore to also find the help there, because a lot of children tend not to be more vocal and more verbal about their struggles, but they'll research for help, and all of the therapists in the room know about that Beacon and Guardian system, so they will do their research, and it might not be that they're struggling with suicidal ideation, but that system will capture it and let us know that they need help, because ultimately we want our kids to be able to have to be in better control of their emotions and also be able to receive their education at the very same time. And this is ACEs, Adverse Childhood Experiences. And I know I saw that there was another program that's going on at the same time that addresses ACEs. But if you take a look at these categories, abuse, neglect, and household dysfunction, nationwide, the statistic is that 40% of all children have experienced at least one ACE, one adverse child experience. And then 18% have experienced two. So if you look at this list and household dysfunction, what pops out at you? Mental illness. So our kids they got one ACE already. And then you couple that, like I would be safe to say, and Patty, Lisa, y'all correct me, Dana, correct me, our kids at Compass would have two or more, if not three or more. I'm sure of it. They're dealing with a lot when they come into the classrooms. They're faced with their adverse childhood experiences, and at the same time, they're expected to learn. So I'll breeze through these. I know we're getting pretty close to time. I'll breeze through these pretty quickly. But if you look at Maslow's hierarchy of need, in order to become the best version of yourself, you have to have some basic needs met. So keep in mind, our Compass students have 2 to 3 or more adverse childhood experiences, ACEs, but they're expected to thrive in school. And this is where Compass comes in to really work on these different levels of needs that they have so that they can be the best version of themselves and transition back. So at the very base is the physiological needs, which is your food and shelter and clothing. So although we might not be able to address that from a school standpoint, Compass Academy and all of our schools within our district do the food portion by offering a Help for Kids bags for additional foods in the evenings and on weekends when there may be a lack of food. Also, if our schools find out that there's a need there, you have your school-based therapist who double as a social worker to be able to find additional resources for the family if there is a food need there. So that's how we try to address that particular need. Then there's a need for safety. So if you think about like safety in terms of like within the school setting, and not in a traditional way, but for example, I don't know how to communicate that I'm hurting, that I have been abused, but it's coming out in my behavior, which that's what you address, like coming out in my behavior. I'm clearing a whole desk, but before I got on the bus, I had to dig through the dirty clothes hamper to find something to wear. I got picked at on the bus coming to school. I got beaten last night, or foster care is coming in and I'm being moved to a new foster home placement. All of those things happen, but what we see in the classroom is the acting out behavior. But the things that they're struggling with is underneath. But in Compass Academy, to help with safety, they do a check-in every day. There's not a day goes by that they don't do a check-in or a check-out. And at the check-in, they're gonna find out. And that kid might not give them a lot of words, but they'll know if something is going on. And before they step foot in a classroom, they're gonna go and they're gonna be able to have some time with a therapist or behavior interventionist to make sure that they're on the right track. Love and belonging. So the kid that is in the traditional classroom, they're acting out all the time. If the teacher says, "Who threw that?" what is the whole class gonna say? Johnny threw that. Johnny might not have even thrown that. But because he's in that environment, he's always getting in trouble all the time, they're gonna always assume that he's the one that's causing trouble. Do you think he feels love and belonging in that environment? And it's not intentional on the teacher. It's not intentional on the students. It's just that they don't know how to process all of the things that Johnny is dealing with either, and they may be, as a result, experiencing some trauma from just being in that classroom with him who is struggling. So the love and belonging comes from that smaller environment and that smaller classroom size, the ability to be a little bit more personal and find out what is going on with that child. Esteem. So of course that's pretty self-explanatory. They do an amazing job of celebrating the wins, and sometimes to the outward eye, parents may look at you're giving them some type of reward and you're celebrating them, but they just clear the classroom out. But once they came out of that classroom, they came in that smaller setting with their therapist, they were able to calm down and then tell them what they could have done when faced with that situation again. So we'll celebrate that because in the midst of the situation, they didn't use the skills that we taught them, but they later were able to go back and say, yes, I can do that. And then the next time when you see them actually using those skills that were taught, then we celebrate them even more. And they do a really great job at building the self-esteem and the confidence of the students within the program.
No, I know we've got just a couple of minutes, and so I know a couple of the questions that came up were, how do we transition students back? And so whenever students are ready to return, our therapists work with their home schools, and our teachers work with their home schools, and they come up with a plan of transitioning the student back and say, okay, what does that look like? So for an elementary school student, that's going to look a whole lot different than it does a secondary student. For an elementary student, typically we like to go ahead and that with a natural break in the year, it could be at Christmas time. After Christmas break, we might start have a meeting with that home school, and then in January, that student goes back to their home school for a full day. And then we also have one of our behavior interventionists or someone go and check on that student at the beginning. At the high school, A lot of times we have that student slowly transition. They might go over to a school for 1 block a day and then slowly build up to being over there a full day. And then we have someone that might take them back and forth until they build up into a full day. So that's how that works. And then that way, if they need to be pulled back, they can be pulled back into Compass and get some extra counseling, so then they can say, okay, what are we doing, what's happening? Now, I will tell you, we've had some students that will sabotage so they don't have to go back to a regular school setting because it's safe there. They know they can go to a counselor and they can say whatever they need to say, so they're worried that they might get into trouble. We actually, I don't think we've done it since we've been at Compass, but we're at Clinical Day, we actually painted a wall with chalk paint, so students could go and write whatever, literally whatever they wanted to on that wall, and they would not get in trouble. But you don't have that in a regular school. You can't go and just kind of have the ability to say whatever you need to say, because I go into Crystal's office and I can say whatever I want to say, literally whatever I want to say, and that's a safe space for me and a safe space for us where we can go and do that. We know that outside those walls, there's certain things we can't say, but these kids can do those things at Compass Academy. So it's sometimes you run into, they'll sabotage, they'll have to be able to stay at Compass. And so, which is a good thing and a not so good thing. But our goal is to work them in such a way that they will be able to take the skills that we've given them and taught them and use those when they go back to their home school, is the ultimate goal. Sometimes, and that kind of depends on the student. In some cases, it's taken months. We've had other students, it's taken multiple years for that to happen. We don't like for it to take multiple years, but I would rather it take us multiple years and we do it right and we get the student where they need to be, than we rush them returning to their home school and then they have to return right back. And I will tell you, we've sat here and talked about different traumas kids have been involved with, and I know that the folks back there could probably tell us lots of different things, but the worst thing that I heard recently, we were talking about a student that is a first grader at one of our elementary schools that was having behaviors, and you sit there and you say, well, you know, the school team was trying to figure out why in the world is this child having these behaviors that he's having. The child's in foster care. So it came down to it, the child saw his mother get murdered. So you wonder, what kind of trauma is that? So not only did the child see his mother get murdered, but he saw his mother get murdered, and then he was taken away from the father. Father's in jail, and he was discovered by the neighbor because he was sent by the father to the neighbor's home after he killed the mother, covered in his mother's blood. So that's one small snapshot of things that happen right here in Florence, South Carolina, that we don't hear about. And so then you imagine taking that and we're asking that student, hey, come to school and learn. And when they don't, we're surprised. So not to be a downer on the day, but those are things like that happen. And so Compass Academy, and thank goodness we have a superintendent that said we need people like Crystal, people like our school-based therapist in every single school. Because without them, I'm not sure where we would be and what we would be doing. And so thank goodness that we're being proactive for this. And we're actually, I think as the years go on, we're going to need more mental health workers in the schools. So anyway.
And just to show you the statistics of what Brian mentioned in the very beginning about having children go to the hospital every single day district-wide. I just finished the data collection for this school year. We had 1,184 cases of suicidal and homicidal ideation within our schools. And 109 of those students' lives were saved by inpatient care. So if that is any indicator that this is needed, Compass is needed, it needs to be replicated, it absolutely does. Any questions?
Yes, sir.
Do y'all have any programs like that's geared toward the students of Compass, like their parents and outside? Because, you know, a lot of people don't believe in the whole mental health thing. If y'all go into that school, which is great, and then they go home and then nobody's following up with it, nobody's like it's kind of like.
So a major component of Compass is bringing the parents in and working with parents, and that's a hurdle because we do have some parents, you know, there is a stigma associated with mental health, obviously, and so that's a big hurdle is getting the parents to understand that it's okay to talk about mental health, but we require them to come in and have sessions with the counselors, and also we have a parent liaison that comes in and meets. We've kind of had to trick the parents into coming in, and so we feed them and do some things with them, and then we have her come in and talk to them, which they weren't real happy about to begin with, but it's slowly worked. The staff at Compass has been really, really good with being able to bring the parents in and meet with them and work with them, and they've done a really, really good job with that. Yes, ma'am.
What's the success rate, what you just said happened? That, I don't know how old that child was.
He's first grade.
That just happened in Lee County? And the baby was
Florence County.
4 years old?
Oh, it just happened in Lee County?
Just happened,
Yeah.
and the baby was 4 years old at home, and after the fact, he picked the gun up and took it to his mom, which was already dead. So when do you think, how he's gonna recover? I mean, 4 years old.
Yeah, I mean, go ahead.
So, lots of support all around. Lots of support all around. So yes, because mental illness, it doesn't just go away. They'll get better. They'll learn how to cope better, but it's not something that's going to go away instantly. So we literally wrap support around them every step of the way throughout the years for as long as they need it. Community-based agencies maybe or may not can only have kids on their caseloads for a certain amount of time. They won't have them in services. That's not the case for Florence School District 1. Ability to pay is not the case for Florence School District 1. Our kids can be in therapy services from kindergarten through high school. And they can have it every single year. And if they met certain goals, of course, we'll discharge them from services, but we won't take our hands off of that child while they're in our district every step of the way. And when he gets older, if he needs to be in Compass, that's what he'll be.
What's the minimum or maximum of students you can have in that class?
So, Patty. So the question is the minimum, maximum of students in Compass Academy.
So it's a little bit flexible. We have found that 8 to 10 is what's best for the students. When we exceed that number in the classroom or on a caseload, the students start telling us that it's a problem because they need so much support, whether it's from a counselor, a teacher, and there's only so much time in the day. So when we start to exceed that, the students start saying, hey, I'm not getting enough attention. And the whole purpose of bringing them to Compass was to provide them with that enhanced level of support. So, 8 to 10 per classroom and per counselor.
Thank you all for all of your questions. I know you got a lot of questions. You're gonna have to find them afterwards because I got to get y'all moving on to the next thing. Hold on 1 second, I have some instructions. Again, let's give them a hand. This was a wonderful presentation. A lot of great information.